Organisations internationales et régionales, Mesdames, Messieurs les représentants des partenaires au développement, distingués invités, Mesdames, Messieurs, à cette occasion de la 20e session extraordinaire de la conférence de l'Union africaine, je déclare ouverts les travaux de cette session extraordinaire. Merci beaucoup.
Your Excellency Evariste Ndayishimiye, President of the Republic of Burundi and Chairperson of the African Union. Your Excellency John Dramani Mahama, President of the Republic of Ghana and African Union Champion on Financial Institutions. Your Excellencies, Heads of State and Government of the Member States of the African Union. Your Excellency Mahmoud Ali Yusuf, the Chairperson of the African Union Commission, Your Excellencies, Honorable Ministers, Your Excellency Amatum Amoa, AUC Commissioner for Health, Humanitarian Affairs and Social Development, Your Excellencies, Ambassadors, Permanent Representatives of the Member States of the African Union and international partners, Your Excellencies, Heads of Organs and specialized agencies of the African Union, Your Excellencies, Heads of Regional Economic Communities, Your Excellencies, Heads of United Nations specialized institutions and international organizations, Your Excellencies, Heads of African financial institutions, distinguished delegates, members of the press, ladies and gentlemen, all protocol duly observed. Good morning to everyone. Good morning and welcome to this extraordinary session of the African Union Assembly on ending AIDS by 2030 and addressing preventable maternal deaths, communicable and non-communicable diseases endemic to the continent and strengthening health systems by 2030. Held under the theme Advancing Justice, Equity and Universal Health Coverage, Ending AIDS and tuberculosis, improving maternal health, addressing endemic, non-communicable and neglected tropical diseases and conditions in Africa, this session represents an excellent opportunity to exchange the views on important themes related to the health sector in Africa. Excellencies, ladies and gentlemen, during today's opening ceremony, we'll have the pleasure of hearing from His Excellency John Dramani Mahama, His Excellency Mahmoud Ali Yusuf, and His Excellency Evariste Ndayishimiye. Excellencies, ladies and gentlemen, now I have the immense honor of inviting His Excellency John Dramani Mahama, President of the Republic of Ghana and African Union Champion on Financial Institutions, to kindly deliver his opening remarks. Excellency, please, you have the floor.
Thank you very much. Excellencies, heads of state and government, distinguished guests, ladies and gentlemen, let me proceed on the established protocol. On behalf of the government and the good people of the Republic of Ghana, I bid you welcome in the most special way, and as we say in Ghana, we say akwaba, which means welcome. You've come to a city that knows something about great beginnings. In December 1958, our first president, Osagyefo Dr. Kwame Nkrumah, gathered the freedom movements of this continent here in Africa at the All-African People's Conference and reminded them that the independence of Ghana would be meaningless unless it was linked to the total liberation of the African continent. 68 years on, Excellencies, you've returned to Accra at another consequential moment. The fight for liberation today is against another kind of oppressor, one that is more subtle, yet no less dangerous. It is the fight against inequality, a fight against oppression of viral diseases, of mothers forced to bury their children, of children denied even a single moment of the innocent joy of a mother's smile. It's liberation from this oppression, Excellencies. Liberation from this oppression, Excellencies, shall be measured in the clinics that stay open in our countries, in the medicines that are manufactured on African soil, in mothers cuddling joyful infants, and in financial budgets adorned with the numbers of our own choosing. We've gathered here because we are the front line of this liberation struggle. We are the generals of the continent's battalion of change seekers. I thank the chairperson of the Union, the chairperson of the Commission, and Commissioner Amachung and her tireless team for the confidence placed in Ghana to lay the groundwork for this campaign to strengthen health systems and combat maternal mortality, infectious diseases, and non-communicable diseases. Some will ask, what is truly extraordinary about this session, given that our union meets regularly to discuss many similarly weighty matters? The answer, respectfully, is that the hour itself is extraordinary. By our own decisions in Addis Ababa, this assembly requested a fully costed continental roadmap to 2030 and beyond. We adopted it in February 2025 and directed that we convene to drive its implementation. That mandate would have been reason enough, but surely not extraordinary. World affairs today have, however, conspired to dramatize the situation. Development assistance for health fell more than 1/5 in a single year, from around 49.6 billion to about 39.1 billion. And so on average, significant numbers of our member states still finance roughly half of their health budgets from external sources. The temptation is to reach for words like crisis, catastrophe, maybe even apocalypse. But our duty today is to urge us to seek other acceptable language, words of urgency, no less, but of a different spirit. Let us not dress despair in the robes of earnestness. We should not succumb to panic and call it vigilance. After all, the system that is crumbling today was merely the scaffolding on the building. No one building, something enduring, a monument their descendants will be proud of, spends their time stuck on the scaffolding. Who bemoans the discarding and dismantling of the scaffolding? It is always the tower that we must uphold. Our eyes should remain fixed on that towering edifice of African liberation. The question haunting this meeting today is simple. Are we builders of towers, or we are merely erectors of scaffolds? Excellencies, I want us to examine the books together. Our continent is still home to 2/3 of the 40 million people living with HIV worldwide. A true tragedy. But the more encouraging fact is that AIDS-related deaths have fallen by nearly 3/4 since their peak. Right there is the proof we need that when we rise to the occasion, our problems will crumble at our feet. On tuberculosis, I often hear that 17 of the world's 30 highest burden countries remain in Africa. What I don't hear as often is that the incidence is down by 28% and deaths are down 46% in under 1 decade. On malaria, not a month passes without a new song being composed about how the continent still bears around 95% of the world's cases and deaths, most of them children under 5. And the tune grows even more mournful when we are told that the changing climate escorts the mosquitoes into highlands that were once malaria-free. We can go on and on from one beat of gloom to another. For example, more than 90 million of our people live with chronic hepatitis B or C, most of them undiagnosed. Neglected tropical diseases still blind, disfigure, and stigmatize our people. And if you're observant, you'll notice that most accounts of the global infectious disease burden present a uniquely depressing African perspective. But the truth is that the face of diseases is changing on our continent. We're steadily converging with the rest of the world in the types of ailments that inflict the most harm on our people. Non-communicable diseases already claim over 2 million of our people before their 70th birthday each year. Cervical cancer alone kills more than 80,000 African women each year. Mental ill health is heavily undercounted in nearly every national plan on the continent. And so what does this really mean? It means that the days when colonial tropical medicine could cast a continent as uniquely benighted and in need of missionary kind of episodic interventions are over. Africa now stands at a crossroads, defined by its appetite for total health transformation. It can no longer allow itself to be perched on the periphery and cast as the destitute beneficiary of the largesse of some distant global health systems. If we allow these stereotypes to persist, a new wave of health conditions will dominate mortality in Africa by the middle of the century, taxing our demographic dividend before it is ever paid. And that is why the Presidential Council of the Accra Reset convened a high-level panel on reform of the global health architecture and governance to consider a root, stem, and branch transformation of the mindsets, policies, programs, and systems that define global public health today. That meeting took place in Dakar, Senegal. But we're not by this action delegating our agency to any notion of an abstract global health hierarchy. While the high-level panel is independent, we have been emphatic that we don't want another list of lamentations. We have no plan to go around employing others for salvation. What we want is ideas that put the global south, the global majority, and our African family firmly in the driving seat of our own health destinies. And that is why the panel's normative and intellectual work is harnessed to the Health Investment National Gateway Enablers, in short, HINGE, and the Reform Interlock Observatory, RIO, platforms we are also building within the Accra Reset movement. We must build sockets at home to connect public initiatives with private investment and unblock barriers in the way of turning health from being a fiscal sink into an economic multiplier. Here in Ghana, we have created a whole new set of anchors for the regional harnesses that I've just described. These include the Ghana Medical Trust Fund, which Ghanaians, with their customary sense of humor, have christened Mahama Cares. Through these instruments, we are shielding families from the ruinous cost of chronic diseases. I'm proud to observe, Excellencies, that many of you are taking similarly bold steps in your own countries. Regarding our mothers and newborns, I wish to express my strongest personal support for President Samia Suluhu, our AU champion for maternal and child health, and to inform the Assembly that through Accra Reset, we hope to work very closely together on the Mother Africa call to action. This is the continent's first charter in support of the African Union's roadmap on maternal and child survival, which is built around measurable objectives and a clear set of reform principles. I therefore urge that we carry the same sense of ambition into each and every one of our deliberations, nor should we, even as we aim high, forget those of our brothers and sisters who are at the lowest ebb of life, those in conflict areas and internally displaced persons, where clinics have been razed to rubble and cold chains have become heaps of broken containers. The sovereign health agenda that is guiding our step as we march out of dependence will ring hollow if we cannot reach every corner of our continent. We cannot have the fog of war in the beautiful Congo Basin cloud, the spread of Ebola on the delightful banks of the Nile. By now, we've all heard that Africa imports around 70% of its medicines, more than 90% of its medical devices, and over 99% of its vaccines. We all remember standing in the queue in 2021, cash in hand, watching others served first as the panic of COVID-19 threatened to overwhelm the world. We learned a bitter lesson, and thank God we have learned from it. Today, it gives me great pride to see vaccines flowing from Dakar, to see messenger RNA sciences being catapulted from Cape Town, to see the head of Ghana's brand new Vaccine Institute go toe-to-toe with biotech strategists around the world, to hear the new facility for cutting-edge biologicals humming on the streets of Kigali. Excellencies, we are the generals of the Army of African Health Transformation. Allow me to announce for your hearing pleasure that the pharmaceutical manufacturing plan for Africa is no longer a mere scribble on paper. The African Medicine Agencies under Dr. Mimi Darko is moving from treaty to working instruments, and the strategic joint procurement and a continental active pharmaceutical ingredient strategy will give our manufacturers the boost they have been waiting for and they so long deserve. We know very well that health value chains mean factories, laboratories, and dignified work for our young people. Sewn together by the African Continental Free Trade Area, sovereignty in health, it turns out, is also an industrial policy, a structural transformational agent, and a liberation strategy. 25 years ago in Abuja, we promised to devote 15% of our national budgets to health. That promise is now old enough to have children of its own. So the pledges we make this afternoon must be physical, not lyrical. Through the African Leadership Meeting commitments and the Program for Financing and Investing in African Health, through debt for health arrangements, solidarity instruments, and protected budget lines that survive electoral cycles, let each of us bring the Ministry of Finance to the health table and keep it seated right at that table. Prevention repays us ninefold. Show me a better bond in the economy market than prevention. Excellencies, this afternoon, we shall deliberate amongst ourselves on local manufacturing, financing, and governance and leadership. Our member states will pledge, and we shall adopt the Accra Declaration. As your host and your brother, I make one request of all of us. Let us not adopt another eloquent text. Let us seal our pacts with our words of honor. The declaration establishes a continental monitoring, reporting, and accountability framework, which we hope to align with Accra Research Framework. We commit to an annual scorecard to be regularly brought to this very assembly for peer review amongst us. And I ask that we embrace that scorecard as the mark of a union that has grown confident enough to grade itself. We are no longer under colonial adult supervision. Our elders in Ghana say, "Tekro enko ejina." It means one head does not hold counsel with itself. And that is why the founders gave us an assembly, and why you have honored Ghana by bringing this council to Accra. Many of the people we serve will not get to read our declaration, but they must feel it. They must feel it in stock shelves. They must feel it in efficient clinics, in running taps, in punctual diagnosis. They must feel it in mother and child poses for cameras with a smile and pride welling in their chest, that they have been well looked after. Let the record show that when the old uncertainties fell away, the leaders of Africa met in Accra and once more plotted our continent's total liberation from the plagues of oppression and prejudice. Let me welcome you once again, Excellencies, to Ghana. Ghana is your home. This is Africa's day, and I leave you with the immortal words of our first president again, Kwame Nkrumah. And he said, "Think like people of action and act like people of thought. I thank you. Asante sana. Medawasi.
Thank you, Your Excellency. And now it's my pleasure to invite His Excellency Mahmoud Ali Yusuf, Chairperson of the African Union Commission, to deliver his speech. Excellency.
Excellence, Monsieur John Dramani Mahama, Président de la République du Ghana, notre hôte, Excellence, Monsieur Evariste Ndayishimiye, Président de la République du Burundi, Président en exercice de l'Union africaine, Excellences, Mesdames et Messieurs les chefs d'État et de gouvernement et des délégations, Excellences, Mesdames et Messieurs les dirigeants des institutions régionales et internationales, Mesdames et Messieurs, à l'entame de mon propos et au nom de la Commission de l'Union africaine, j'aimerais adresser mes remerciements au Président Mahama et à son gouvernement pour l'accueil et l'hospitalité chaleureuse. Mesdames et Messieurs, ce sommet extraordinaire sur la santé en Afrique s'inscrit dans une démarche de consolidation des acquis. Ensuite, la poursuite des efforts pour parvenir à la souveraineté sur le continent. Certes, les progrès accomplis sont louables. Les décès liés au sida ont diminué de près de 3/4. La morbidité à la tuberculose poursuit son recul. La mortalité infantile et maternelle a fortement baissé ces 20 dernières années. Ces avancées sont le fruit de l'engagement de nos États membres à améliorer considérablement la situation sanitaire dans nos pays. Je tiens ici à saluer le soutien constant de nos partenaires pour leur contribution à ces efforts. Cependant, les défis restent entiers. L'Afrique concentre encore les statistiques les plus élevées des maladies transmissibles et non transmissibles. Cette réalité sanitaire repose sur la fragilité structurelle de nos systèmes de santé et la diminution rapide des financements extérieurs consacrés à la santé. Il nous appartient donc de regarder cette réalité en face. La souveraineté sanitaire du continent ne peut plus demeurer suspendue aux arbitrages budgétaires extérieurs. Il nous faut financer notre santé, former nos talents et produire nos solutions. L'objectif de la déclaration d'Abuja de consacrer 15% des budgets nationaux à la santé est un passage obligé. Cela suppose une mobilisation accrue des ressources nationales, une meilleure implication du secteur privé et de la philanthropie africaine. Cela implique aussi un investissement conséquent dans les hommes et les femmes qui font vivre notre système de santé, médecins, infirmiers, sages-femmes, aides-soignants et chercheurs. Pour atteindre cet objectif, l'Afrique s'est dotée d'une feuille de route à l'horizon 2030. Cette ambition pourra se réaliser si le continent se dote d'une chaîne de valeur de la santé. La production de vaccins, de traitements et leur commercialisation à travers la ZLECAf. L'homologation des médicaments sous le contrôle de l'Agence africaine du médicament. La lutte contre les épidémies par le biais de l'Africa CDC. Le renforcement des capacités et le développement sous l'égide de l'ODA-NEPAD. Par ailleurs, l'Afrique a adopté cette année le thème de l'eau et de l'assainissement qui représente le socle de tout système de santé. J'aimerais, à partir d'Accra, réaffirmer haut et fort que la santé de nos peuples ne peut être restreinte à une dépense publique. À l'instar de l'éducation, la santé est le dividende du progrès et le gage d'un avenir meilleur pour nos populations. Your Excellencies, I am confident that the commitments to be announced today will mark an important milestone. An Africa that depends on others to protect the health of its populations cannot claim full sovereignty. Our ambition is to seek self-reliance by bearing full responsibility. The reason why we contemplate a continent that stands tall in all sectors, and in particular in universal health care for all our African citizens. I thank you.
Thank you, Your Excellency. And now I have the pleasure of inviting His Excellency Evariste Ndayishimiye, President of the Republic of Burundi and Chairperson of the African Union, to deliver his speech. Your Excellency, please, you have the floor.
Excellences, Monsieur John Dramani Mahama, Président de la République du Ghana et hôte de cette session extraordinaire et chers frères, Excellences, Madame et Messieurs les chefs d'État et de gouvernement, Excellences, Monsieur le Président de la Commission de l'Union africaine, Excellences, Mesdames, Messieurs les chefs des organes et institutions de l'Union africaine, honorables Mesdames, Messieurs les chefs, les membres du gouvernement du Ghana, Mesdames, Messieurs les chefs des organisations internationales et régionales, Mesdames, Messieurs les représentants des partenaires au développement, distingués invités, Mesdames, Messieurs, que le Seigneur Dieu Tout-Puissant soit loué pour ses bienfaits. Au nom de l'Union africaine, j'adresse nos sincères remerciements à son Excellence et mon cher frère, le président John Dramani Mahama, au gouvernement et au peuple de la République du Ghana pour l'accueil chaleureux réservé à toutes les délégations ainsi que pour avoir gracieusement accueilli cette session extraordinaire de la conférence de l'Union africaine consacrée à la réalisation de l'une des aspirations les plus fondamentales de l'agenda 2063, une Afrique en bonne santé, résiliente et prospère, où chaque citoyen jouit du meilleur état de santé et de bien-être possible. Je félicite également la Commission de l'Union africaine, Africa CDC, l'ODA NEPAD, les communautés économiques et régionales, les partenaires au développement, la société civile, le secteur privé ainsi que toutes les parties prenantes dont l'engagement a rendu possible cette importante rencontre. Excellences, Mesdames, Messieurs, nous nous réunissons aujourd'hui à Accra autour d'un thème particulièrement opportun et porteur: promouvoir la justice, l'équité et la couverture sanitaire universelle, mettre fin au sida et à la tuberculose, améliorer la santé maternelle et lutter contre les maladies non transmissibles endémiques et les maladies tropicales négligées en Afrique. Ce thème traduit l'engagement collectif de l'Afrique à garantir à chaque citoyen un accès équitable à des services de santé de qualité. Il y reconnaît que la justice, l'équité et la couverture sanitaire universelle ne constituent pas un fait en soi, mais les moyens de bâtir des sociétés à meilleure santé, des économies plus fortes et un continent plus prospère. Ainsi, cette session extraordinaire est convoquée en application de la décision 852 de la conférence des chefs d'État et de gouvernement de l'Union africaine, par laquelle notre conférence a commandité la tenue de cette session et a appelé à accélérer les efforts visant à mettre fin au sida d'ici 2030, à lutter contre les décès maternels évitables, à combattre les maladies transmissibles et non transmissibles, à renforcer les systèmes de santé et à accroître progressivement un financement national durable pour la santé. Cette journée marque donc une étape importante dans la mise en œuvre de cette décision ainsi que dans l'avancement de la feuille de route de l'Union africaine à l'horizon 2030 et au-delà, qui est de pérenniser la riposte au sida, renforcer les systèmes de santé et la sécurité sanitaire au service du développement de l'Afrique. Excellences, Mesdames, Messieurs, l'Afrique a démontré que lorsque le leadership s'accompagne de politiques publiques solides et d'investissements soutenus, des progrès remarquables sont possibles. Au cours des 2 dernières décennies, des millions d'Africains supplémentaires ont eu accès à des traitements vitaux contre le VIH-Sida. La survie des mères et des enfants s'est améliorée des avancées significatives ont été enregistrées dans la lutte contre la tuberculose et le paludisme et la couverture vaccinale s'est élargie. Cependant, notre tâche est loin d'être achevée. Des millions d'Africains continuent d'être touchés par le VIH-Sida, la tuberculose, le paludisme, les hépatites virales, les maladies tropicales négligées, ainsi que par le fardeau croissant des maladies non transmissibles. Le cancer aussi prend une ampleur inquiétante chez les jeunes surtout que les adultes. Les décès maternels et néonatals évitables demeurent à un niveau inacceptable, tandis que les crises humanitaires, les nouvelles menaces sanitaires et l'évolution du paysage mondial du financement de la santé continuent à mettre à rude épreuve la résilience de nos systèmes de santé. Ces réalités exigent un niveau encore plus élevé d'engagement politique et d'action collective au niveau de nos communautés. Excellences, Mesdames, Messieurs, dans mon pays, nos réponses reposent sur une méthode réplicable pour contrôler les maladies. Le réseau de santé communautaire du Burundi, qu'on a appelé Abaremesha Kiago, a été un maillage sanitaire innovant fondé sur la sensibilisation de la santé productive, la vaccination, l'hygiène et surtout des campagnes massives de dépistage précoce des maladies assurant un diagnostic rapide dans les zones isolées. C'est cette culture de détection précoce et de prévention qui a permis au Burundi de franchir une étape historique l'an dernier en intégrant le vaccin contre le paludisme à son programme d'immunisation. Ce modèle combine au dépistage de proximité et la réponse vaccinale aux maladies, et ceci acquiert une véritable signification que s'il inspire, se diffuse et devient un bien commun pour notre continent. C'est le sens de l'appel que je porte devant vous aujourd'hui. Faisons de la solidarité sanitaire africaine non pas une aspiration, mais une architecture, celle d'une Afrique qui se soigne par elle-même, qui produit ses propres réponses et qui ne subit pas, mais anticipe. Excellences, Mesdames, Messieurs, les défis sanitaires auxquels nous sommes confrontés ne peuvent être relevés au moyen de programmes isolés. Mettre fin au sida, à la tuberculose et au paludisme, réduire les décès maternels et néonatales évitables, lutter contre les hépatites virales, les maladies tropicales négligées et les maladies non transmissibles, et nous préparer aux futures pandémies dépendent tous de systèmes de santé résilients, intégrés et centrés sur les populations. Aussi, nous devons avoir à l'esprit que l'avenir sanitaire de l'Afrique doit être de plus en plus financé par l'Afrique elle-même. Si les partenaires internationaux demeurent indispensables, l'évolution du paysage mondial du financement nous rappelle la nécessité de renforcer la mobilisation des ressources internes, d'améliorer l'efficacité et la redevabilité dans les dépenses de santé, de développer des mécanismes innovants de financement et d'accélérer les investissements dans la recherche, l'innovation et la production pharmaceutique locale. Cette session extraordinaire nous offre l'occasion de réaffirmer que la santé n'est pas seulement une priorité de développement, mais également un investissement stratégique dans le capital humain de l'Afrique, sa transformation économique et son développement durable. À ma qualité de président de l'Union africaine, J'appelle tous les États membres à adopter la déclaration d'Accra comme un engagement continental renouvelé visant à accélérer la mise en œuvre de la feuille de route de l'Union africaine à l'horizon 2030 et au-delà. Comme l'a bien souhaité aussi mon frère Dramani Mahama, que la déclaration d'Accra nous engage à renforcer le leadership politique, à accroître les investissements nationaux dans la santé, à bâtir des systèmes de santé résilients, à améliorer la redevabilité et à garantir un accès équitable à des services de santé de qualité pour chaque Africain. Qu'elle réaffirme également notre détermination à renforcer les soins de santé primaires, à améliorer la santé maternelle et infantile, à accélérer la lutte contre les maladies transmissibles et non transmissibles, à intégrer la nutrition dans les politiques de santé et de développement et à faire progresser la couverture sanitaire universelle sur l'ensemble du continent. Faisons par conséquent en sorte qu'Accra ne soit pas simplement le lieu où nous aurons adopté une nouvelle déclaration, mais qu'elle soit reconnue comme le moment où l'Afrique a choisi la mise en œuvre plutôt que les promesses, la solidarité plutôt que la fragmentation et l'action collective plutôt que la complaisance. Ensemble, faisons progresser la justice, l'équité et la couverture sanitaire universelle. Ensemble, poursuivons la mise en œuvre de la feuille de route de l'Union africaine à l'horizon 2030. Ensemble, bâtissons l'Afrique que nous voulons. Je vous remercie de votre aimable attention.
Merci beaucoup, Votre Excellence. Il a été décidé de procéder avec la photo de groupe plus tard. La secrétaire de la Commission nous guidera pour la suite des travaux pour l'instant. Monsieur le Président de l'Union, je vous rends la parole accordée.
Excellence, Excellences, Madame, Messieurs les chefs d'État et de gouvernement de l'Union africaine, honorables chefs de délégation, Excellences, Mesdames, Messieurs les chefs de délégation, Son Excellence Mahmoud Ali Youssouf, président de la Commission de l'Union africaine, Excellences, Mesdames, Messieurs les ministres, Excellences, Mesdames, Messieurs, je voudrais saisir cette occasion pour féliciter le comité des représentants permanents ainsi que le conseil exécutif qui nous ont préparé les documents de travail ainsi que le projet d'ordre du jour. En ce moment, et comme nous sommes toujours en séance plénière, permettez-moi de proposer de commencer les messages de solidarité des partenaires et pour pouvoir permettre à tout le monde d'intervenir à temps, je voudrais que chaque partenaire ait 3 minutes et j'en appelle au respect de son temps. À ce moment, je voudrais maintenant inviter Monsieur Dr Tedros Adhanom, directeur général de l'OMS, à nous livrer son message. Vous avez la parole.
Thank you, Your Excellency. Your Excellency, President Mahama, Your Excellency, President Ndayishimiye, Your Excellency, President Samia Suluhu, Your Excellency, President Wadanyi, Your Excellency, Deputy Prime Minister Temesgen Turuna, Your Excellency, Chairperson Mohammed Ali Yusuf, Honorable Ministers, distinguished delegates, colleagues, and friends. Good morning, and thank you, President Mahama, and thank you, Ghana, for hosting this historic summit, the first extraordinary session African Union Assembly ever dedicated to health. And also thank you for your leadership on African health sovereignty from last August Accra Summit to the Accra Reset that followed. This also speaks to Agenda 2063, the Africa we want, a vision I was part as Ethiopia's foreign minister in 2013. And let me share an honest assessment of where we stand. Africa has made extraordinary progress against HIV, with new infections down 40% since 2010. But Africa still carries the heaviest burden, and as external funding declines, we risk losing ground. The same challenge runs through maternal health, tuberculosis, malaria, neglected tropical diseases, and rising non-communicable diseases. These are not separate crises. They are one crisis. Health systems not yet strong enough to protect every person on this continent in our Africa. Conflict also makes this harder. As you may know, in Bunia, Ituri province, an Ebola outbreak is spreading amid active armed conflict, slowing contact tracing and keeping health workers from communities. Treating disease alone is not enough. We must also tackle what drives it: conflict, poverty, poor education, unsafe water, and gender inequality. That's why strengthening health systems must be at the center of everything you decide in Accra. WHO stands with you as a partner, providing technical guidance and support, but only Africa's leaders can deliver the political will and domestic investment this moment requires. As you finalize your roadmap, hold to a few principles. Let domestic resources lead. Invest in primary healthcare and local manufacturing, use the science available today, and protect the most vulnerable, and hold each other accountable, because the declaration is only as strong as the follow-through behind it. On these issues, by the way, I'm glad that we're well aligned with all the speakers before me. By the way, the other issue is, today it's actually 80 years anniversary of WHO's constitution. It was signed on this day, January 22nd, 1946. The WHO Constitution was signed and it declared health as a fundamental human right for every person. Africa's own history has shown the world what's possible when this continent leads. You have the roadmap, the evidence, and the authority to change the trajectory of this continent's health for generations. WHO will be at your side every step of the way. I thank you.
Merci beaucoup pour vos observations. À travers vous et au nom de l'Union africaine, je voudrais féliciter et remercier l'OMS pour tous les efforts fournis pour mettre fin au VIH-Sida et à la tuberculose, améliorer la santé maternelle, lutter contre les maladies non transmissibles endémiques et les maladies tropicales négligées. Nous vous remercions beaucoup et maintenant, je voudrais inviter professeur Senayi Fisera, vice-présidente du programme mondial Fondation Suzanne Buffett Thompson.
Good morning, Excellencies. All protocols observed. I've been given only 3 minutes. If I attempt to recognize every distinguished leader individually in this room, my time would be over before I begin my remarks. So please accept this collective greeting with my deepest respect and my gratitude for the leadership represented here today. I'm profoundly honored to be here as we come together to decide how we would like to tackle some of the bigger and pressing health issues we are facing in our continent today. As our theme reminds us, we are here to talk about ending inequity, injustice in healthcare, and I'm going to focus on one of the gravest injustices and inequities in the continent that threatens women and girls. That is preventable maternal death. Let us be clear. When we talk about preventable maternal death, we're talking about a crisis. That word is often reserved for emergencies like disease outbreaks, COVID, Ebola, Marburg, natural disasters. However, maternal mortality is as important, if not more important, a critical crisis that is not visible and doesn't often make the headline news. According to the WHO's 2023 report, 70% of global maternal mortality happens in our continent, and that is close to 200,000 women dying annually while giving birth. To the women, to the girls, to the communities affected by it, this is indeed a crisis. Evidence continues to show that access to sexual and reproductive health care is one of the most effective ways to reduce maternal mortality. But after decades of donor-driven interventions and disease-specific programs, most of our health systems are not equipped to deliver the services to everyone that needs them. And it's women and girls who pay the cost, many of them with their lives. Excellencies and distinguished guests, the world around us is changing, and it's changing very rapidly. Long-standing funding streams are being cut. Global supply chain that we depended on for our medications, vaccines, and medical equipments are growing even more expensive and unreliable and are getting disrupted. We can no longer count on the data sources that we use to track our health outcomes. However, I truly have been deeply moved in the last year to see firsthand that when confronted by these realities, so many of our leaders in this continent really stood up. Leaders in this room, they did not see them as roadblocks, but rather as opportunities. So, as partners, we should respond to these realities by supporting and championing African-led solutions to our continental problems. Our task is not to create another initiative, but to accelerate implementations of our continent's unparalleled frameworks, to turn these resolutions into finance national plans and quality services and measurable results for women and girls. I believe that requires 3 commitments. First, we must align. We must begin with country priorities and partners under African leadership. Partnership that reinforce national plans, African institutions, and not compete with them or prescribe solution. For many of you that know, we've been championing the one plan, one budget, one report that Dr. Tedros started when he was a health minister in Ethiopia that has now been adopted by GFF and so many other institutions globally. Second, we must plan and act for the long term. Ending preventable maternal death, HIV, or any of the chronic scourges that we deal with in this continent will not be achieved through short-term, isolated projects. They require sustained investment in public systems, local institutions, health workforce, commodities, and community trust. Third, we must hold ourselves accountable. All of us must be held accountable for whether our partnerships help reduce fragmentation, strengthen local capacity, and produce results for the communities we serve. So at the Buffett Foundation, we're ready to deepen our commitment in the 7 countries that we're already present we're ready to go a lot deeper. We plan to make substantial additional investments over the next decade to support country-led efforts and end preventable maternal deaths, and to strengthen the systems required to deliver essential reproductive and maternal health care at scale. As we have done, we'll continue to shape this commitment with partner countries and support approaches that are led by governments, grounded in evidence, and capable and enduring for the future. And we hope to see a shift across the health and development sector towards greater alignment, flexibility, and sustained support for countries to deliver on this agenda. But today should not be remembered for the number of new initiatives. As President Mama has said it a lot better than I would ever articulate. I think it should be remembered as a moment when African leaders submitted and committed to, at an extraordinary health summit, really coming together to say we are committed to tackle inequalities, to end injustices, and determine our sovereignty. Excellencies, we have lost at least 5 lives since I have been speaking, but a maternal death is never only a statistics. It's a profound loss to a family, a community, and a nation. So let Accra mark a shift from declarations to delivery, from fragmented projects to resilience, country-led systems, and from preventable loss to dignity, agency, and life. Together, let us show how African women and girls and their health matters, their choice matters, and their lives are worth protecting. Once again, we remain resolute in our pursuit of our shared goal. We'll continue to invest in public systems, local organizations, and regional institutions who will sustain this work. We will listen, we will align, and we'll work alongside you. Thank you.
Merci, Madame. Maintenant, j'invite Dr Winnie Byanyima, directrice exécutive ONUSIDA, représentant le secrétaire général des Nations Unies.
Thank you, Your Excellency. Your Excellency, John Dramani Mahama, President of Ghana, Your Excellency, Ndayishimiye, President of Burundi, Your Excellency, President Samia Suluhu Hassan of Tanzania, Your Excellency Ramoud Wadanyi of Benin, Your Excellency Mahmoud Ali Yusuf, Chairperson of the African Union Commission, Excellencies, heads of government, ministers, distinguished delegates, it is a great honor to address this historic summit on behalf of the Secretary General of the United Nations, Antonio Guterres. He sends his warm greetings and his deep appreciation to the African Union for convening this important meeting. The Secretary General has always believed that no global challenge can be solved without African leadership. Today's summit is further proof that Africa isn't simply responding to the global health agenda. Africa is helping to shape it. Before I begin, let me pay tribute to the governments, the frontline health workers, the scientists, the community leaders and volunteers in the Democratic Republic of Congo and Uganda who are courageously responding to Ebola. I also acknowledge the leadership and the support of the African Union, particularly Africa CDC and its leader, Jean Kaseya, the World Health Organization, the entire UN system, and all partners supporting this response. The courage of the frontline workers is inspiring. For decades, distinguished delegates, Africa has faced overlapping waves of pandemics, never fully recovering from one before confronting another one: HIV, Mpox, COVID, Marburg, Ebola. The Global Council on Inequality, AIDS, and Pandemics, which I convene, found that pandemics and inequality reinforce one another in a vicious cycle. Inequalities allow outbreaks to become pandemics. Pandemics, in turn, deepen inequalities within and between countries, and then they become more vulnerable to the next pandemic. Breaking that cycle is one of the defining challenges of our time. Just a few weeks ago, Africa demonstrated how to do exactly that. Through your Common Africa position, adopted by ministers of health, you helped shape the political declaration on HIV/AIDS adopted by the United Nations, at the United Nations by the member states of this world. Africa spoke with one voice and the world listened. I congratulate you. That declaration reflects Africa's priorities and gives us a powerful platform to rally the whole world behind the actions needed to end AIDS by 2030 and to strengthen preparedness for future pandemics. At its heart is a simple but powerful idea. Epidemics thrive on inequality. We end epidemics by closing inequalities. The declaration commits us to closing 3 of the most important inequalities that continue to drive the AIDS pandemic. The first one is to close the inequality in sustainable financing that has been spoken about here. No country can end AIDS while constrained by shrinking fiscal space, unsustainable debt, and unfairness in global financial markets. Closing this inequality means giving that countries gaining that fiscal space to invest in health systems that are resilient, strong community responses. It means domestic investment supported by international solidarity and a fairer global financial architecture, and global corporate tax collaboration to end tax dodging that denies Africa of its fair resources. Sustainable financing is not charity, it is an investment in health security, in our development, in our futures. Second, we must close the inequality in access to innovation. Scientific breakthroughs save lives only when they reach the people who need them the most. Innovation without access is not innovation, it is discrimination. Africa knows too well the cost of waiting for ARVs, for COVID vaccines, and now for the newest long-acting HIV prevention technologies on the market in Europe and America. Closing this inequality means ensuring equitable access to innovation, expanding technology transfer and local production, and enabling Africa not only to use the new health technologies, but to produce and improve them. We have the talent, we have the institutions, we have the market. Health sovereignty means not just being consumers, but producers and innovators. Third and lastly, we must close the inequality in the enjoyment of human rights and gender inequality. AIDS follows inequality. When girls are denied education, when women lack equal opportunities and control over their own bodies, when communities face stigma and discrimination, and where laws exclude rather than protect, the virus persists. Closing this inequality means ensuring that every person can access prevention, treatment, and care without fear, discrimination, or exclusion. Human rights are not separate from the AIDS response. They are among the most powerful determinants of success. So, Excellencies, Africa helped to write this political declaration that the world signed on to. Now let us use it to rally the world around one common purpose: closing the inequalities that drive ill health. Closing inequality in sustainable financing, closing inequality in access to innovation, closing inequality in the enjoyment of human rights and gender equality. If we close these inequalities, we will not only end AIDS as a public health threat, we will build stronger, fairer, and more resilient systems for health, better prepared for the next pandemic. Epidemics thrive on inequality. We end epidemics by closing inequalities. The United Nations is proud to stand with the African Union on that journey. I thank you so much.
Merci beaucoup de votre belle présentation et votre engagement. Maintenant, je voudrais inviter le représentant de la Banque africaine de développement pour sa présentation. Représentant de la BAD, ce n'est pas présent. Et cela, mesdames et messieurs, à présent, nous allons nous tourner vers notre institution et écouter les représentants des différents responsables des organes et des agences de l'Union africaine. Et je voudrais par là commencer par Son Excellence ambassadeur Ama Toun Amoa. C'est le commissaire à la santé. C'est aussi 3 minutes. Nous devons gagner du temps. Avoir 3 minutes pour la présentation.
D'accord. In that case, Your Excellencies, heads of state and government, distinguished ambassadors, excellencies, permanent representatives, and distinguished participants. It is indeed a great honor to address this extraordinary session of the Assembly as we renew Africa's collective commitment to the health and well-being of our people. This summit is far more than another milestone on our continental calendar. It is an opportunity to reaffirm that health is the foundation of Africa's development, the anchor of our security, the measure of our resilience, and a pathway to our shared prosperity. In February 2025, our heads of state and government adopted the AU roadmap to 2030 and beyond on sustaining the AIDS response, ensuring system strengthening and health security for the development of Africa. In doing so, they laid the foundation for a new era of African ownership, health security, and sustainable action. Across our continent, we have expanded access to life-saving treatments, reduced AIDS-related death, strengthened disease surveillance and laboratory networks, widened immunization coverage, and built institutions capable of responding to complex public health threats. The COVID-19 pandemic demonstrated both Africa's resilience and its vulnerabilities. It exposed deep inequalities and inequities in access to vaccines, diagnostics, and medicines. Yet, it also catalyzed unprecedented continental cooperation and reinforced an enduring lesson, which is Africa's health security must be built upon strong national health systems, effective continental institutions, and regional solidarity. Excellencies, despite the progress achieved, our work is far from complete. HIV, tuberculosis, and malaria continue to impose a heavy burden on our member states. Preventable maternal, newborn, and child death remain unacceptably high. viral hepatitis and neglected tropical diseases continue to affect millions of our citizens, often silently. At the same time, non-communicable diseases, mental health conditions, injuries, and the effects of climate change are placing increasing pressure on already overstretched health systems. These challenges are compounded by food insecurity, unsafe water and inadequate sanitation, humanitarian crisis, population displacement, rapid urbanization, and constrained health financing. They cannot be addressed through fragmented interventions. They demand health systems that are integrated, people-centered, equitable, and resilient. This is precisely why the AU Roadmap to 2030 and beyond was developed. The roadmap marks a strategic evolution in Africa's health agenda. It moves beyond fragmented, disease-specific responses towards comprehensive health systems capable of delivering quality care throughout the life course. It recognizes that we cannot end AIDS without strong primary health care. We cannot reduce maternal mortality without skilled health workers, functioning referral systems, and universal access to essential services. And we cannot achieve health security without robust surveillance and laboratory systems, local manufacturing, research and innovation, reliable supply chains, as well as sustainable financing. At the heart of the roadmap is integrated, people-centered service delivery. Instead of requiring our people to navigate separate programs, we must bring services together. HIV, tuberculosis, malaria, maternal and child health, nutrition, immunization, mental health, and communicable disease services should be delivered through a coordinated platform, particularly at the primary health care level. Integration improves efficiency, reduces duplication, enables earlier diagnosis, and strengthens continuity of care. It allows member states to achieve greater impact from limited resources. In the present financing environment, integration is not merely desirable, it is indispensable. Excellencies, a roadmap alone cannot save lives. A declaration alone cannot transform health services. And commitments alone cannot protect our people. Progress requires political leadership, sustainable investment, disciplined implementation, and collective accountability. This is why the Accra Declaration before this Assembly is so important. It translates the roadmap into renewed political commitment by our heads of state and government. It calls upon member states to increase domestic investment in health, strengthen public health care, accelerate action against communicable and non-communicable diseases, improve maternal, newborn, and child health, advance nutrition, expand local manufacturing of essential health products, harness digital technologies and innovation, and build resilient systems capable of responding to future crises. Importantly, the declaration recognizes that health cannot be delivered by the health sector alone. Our policies on agriculture, education, housing, employment, water, sanitation, gender equality, climate resilience, and social protection all shape the health of our people. This is especially relevant as the AU commemorates the theme of the year, which is assuring sustainable water availability, safe sanitation systems to achieve the goals of Agenda 2063. Safe water, sanitation, and hygiene prevents disease, saves lives, protects mothers and children, and strengthens communities. A health facility without safe water cannot provide safe care. A community without clean water cannot realize its full human and economic potential. Excellencies, the global health landscape is changing rapidly. Development assistance is under increasing pressure, while competing global priorities are reshaping international financing. Africa must therefore accelerate domestic resource mobilization, improve the efficiency and transparency of health spending, and deepen investment in local manufacturing, research, and innovation. Our future health security must increasingly be anchored in African institutions, African expertise, African innovation, and African resources. The foundations are already in place. Through Agenda 2063, the African Health Strategy, the Africa Health Security and Sovereignty Agenda, the Pharmaceutical Manufacturing Plan for Africa, and the AU Roadmap to 2030 and beyond, our continent has established a coherent framework for transforming health systems, advancing health sovereignty, and our task now is clear: implementation with urgency, accountability, and measurable results. We must translate the AU Roadmap and the Accra Declaration into concrete national action. This means strengthening primary health care, integrating services, increasing domestic investment, advancing the local production of medicines, vaccines, and diagnostics, investing in health workforce, and reinforcing surveillance, laboratory, and digital health systems. Member states must establish clear milestones, monitor progress, and share lessons across the continent. Implementation must move beyond conference halls and policy documents. It must reach every village, every health facility, every mother and newborn, every child and adolescent, every displaced person and vulnerable community. It must reflect safer childbirth and deliver tangible results. Excellencies, the decisions taken today, the declaration provides us the opportunity to draw new commitments. I'm Ellen. So I wish all of us good deliberations. May God bless us all, and may He continue to bless our great continent, Africa. Thank you.
Merci, Madame. Maintenant, nous invitons le directeur général de Africa CDC, Dr Jean Kasseya, pour sa présentation. 3 minutes, s'il vous plaît.
Kasseya, 3 minutes.
Excellence, il n'y a pas une meilleure opportunité de vous célébrer que cette réunion. Donc, laissez-moi donner l'opportunité à toute cette population de célébrer tout ce que vous faites. Je ne prendrai pas très long, mais je vais vous montrer les succès. Oui, Excellence, donc je vous reconnais tout le monde. J'ai une petite présentation à faire et j'espère qu'on est déjà en train de projeter. Vous allez voir ça sur votre écran de l'autre côté. Je ne l'ai pas encore. Excellence, ma présentation, c'est autour d'abord du président John Mahama. Quand vous aviez organisé la réunion de Accra, je suis venu m'asseoir à vos pieds pour comprendre la vision. Vous n'avez pas seulement Accra Reset comme votre fils, vous avez aussi Africa Health Security and Sovereignty. This is the platform that will support the implementation of the AU roadmap. And next slide, please. Excellence, what is putting all of you together is the Africa CDC Committee of Head of State. All of you are members of committee, Africa CDC Committee of Head of State. Look, every day they are saying that Africa cannot deliver, Africa cannot be efficient. Look what we are doing. From 2023 to 2025, we managed to bring utilization rate from 34% to 95%. This is a great success. We managed to increase our portfolio. But more than that, Excellency, next slide, please. More than that, we have impact. This impact, we are celebrating that. We managed to change the face of Africa from red to green in almost all areas. And you can see the impact is the decrease in terms of numbers of outbreaks. Yes, we are still facing a number of challenges. We are still having Ebola, cholera, measles, Marburg, but we are moving because we managed to put in place strong mechanisms. Next slide. And Excellency want to talk about Ebola. Most of you, when you meet me, you are asking, where are we with Ebola? the situation is not good. Yesterday, when I was making the presentation, it was 966 confirmed cases. Today, confirmed deaths, today we reached 1,031. These are people dying. They are dying because we don't have vaccine, we don't have medicine, we don't have funding. And next slide, you will see that if we take a photo of this outbreak, after 9 weeks of declaration, it's the worst one that we have ever. If you compare with what we had in 2014 in West Africa, this current outbreak is 8 times more than that. It means we need solidarity to stop that. Next slide. And this solidarity, Excellency, it's also coming with responsibility and courage. 2 days ago, I sent a letter to the Secretary of Health in the US to officially request him to lift the travel restriction against Uganda, because Uganda is doing a great job. If people from Uganda are here, we need to applaud them. It's giving us an example of what a country can do. Next slide, please. But some challenges are still there, Excellency. One of them is insecurity. I have my team member who got a bullet because he went to Beni to support the response. We cannot accept that. And we are also facing the humanitarian challenge. Next slide, please. By discussing that, next slide, by discussing that we need funding to stop that, I'm so glad. President Evariste, be proud of yourself. When I came to see in Burundi, you told me, please let us applaud for my leader. He told me we wanted to achieve $100 million coming from Africa. We already achieved 110 million. And the good news, you will applaud all of them. Today, this morning, President Mahama told me he's pledging money for this response. Thank you, President. But it's not the only good news. President Romuald Wagdin told me, please come to, next week to Benin. We'll discuss. Thank you, Excellency. Mama Samia, your Minister of Foreign Affairs told me, the Minister of Finance is signing the check. Thank you so much for that. Now our new objective, President Evariste, is to achieve 200 million coming from Africa. This is what we call sovereignty. This is what we call leadership. Next slide, please. Yes, money. It's not, Africa doesn't lack money, Excellency. President Mahama, you released with Excellency, the chairperson, in February 2026, an op-ed talking about how we are wasting our resources. More than 50% of our money is going due to the wastage. We need to fix this issue. It's not about lacking resources, it's managing better the resources. This is why I started with the first slide to show you that in Africa CDC, we are managing better our resources. We need also to see our countries managing better their resources. Next slide. The digital agenda is critical for that. If we don't put a strong digital agenda, we will not succeed. My sister President, Vice President Senate was telling me we need to have the leadership of Africa, managing and owning data. We are moving forward with this agenda. Next slide. Then, local manufacturing. President Mahama, we needed AMA, African Medicine Agency. But what we needed more is the market. We didn't have market. This is why we created the African Pool Procurement Mechanism. Because when you have the market and you have the regulatory aspect, then your agenda of local manufacturing can move. I know that you are a true leader talking about the market, and you'll continue to promote the African Pool Procurement Mechanism. Next slide, please. This is the slide I love a lot. In 2020, when we started the process, I came to see Mama Samia. I like to call her Mama Samia, with my love to you, Mama. I told her, look, we want you to become champion for maternal and child health. She said, are you sure? I said, Mama, when you started as vice president in 2015, the maternal death was 556 per 100,000 live births. After 7 years of you being vice president, you decreased that to 104. Even today, I was informed by my team that the last modeling is giving Tanzania 72. More than 80% of the decrease. Then those were thinking that when Africa Kuhusu decided not only to present but to promote Mama Samia as champion, it was not a political appointment only. It was to recognize your leadership. Mama, I'm proud of you. If all African countries, and this is the impact we are talking about, HIV, TB, malaria, all other diseases, what is the impact to reduce the mortality of mothers and children in Africa? And all of our leaders here, President Mahama with Mahama Care, what you are doing is amazing. President Evariste, I was in Burundi 2 weeks ago. Your program with your Minister of Health was here. It's just amazing. But President Ouagani, let us talk about the Community Health Worker Program. You were Minister of Finance. You provided funding. You were one of the first countries providing sufficient fund for your Community Health Worker Program. And your minister was telling me, after 5 years, we'll upgrade our funding and will be out of the dependency. Now that you are president, I'm coming next week to discuss that with you. Excellency, this is the face of Africa we want to see, when our leaders are coming together to show that something is moving. But I will not forget Ethiopia. The Deputy Prime Minister, Tedros, came from your country. You are the source of Community Health Worker Program. Be proud of what we are doing. Then my last slide, please. I took only 2 minutes. My last slide. How we need to stop the silo approach. How we need to say one integrated backbone system can deliver all programs. If we bring local manufacturing, if we bring sustainable financing, if we bring digital agenda, if we bring community health workers, if we bring the vision that we need, Africa will win. And thank you so much.
Merci. Surtout d'avoir souligné cette question de financement de la santé. Et je voudrais, au nom de l'Union africaine, remercier les pays qui ont contribué pour faire face à l'Ebola. Nous allons poursuivre, et cela, mesdames et messieurs, avec le représentant de l'ODANEPAD, Madame Nardos Bekele-Thomas, sur l'équité en matière de santé et déterminants sociaux de la santé.
Thank you very much. Excellencies, Presidents and Heads of States present here, our Chairperson of the African Union Commission, all honorable ministers in attendance, colleagues from the African Union organs, international organizations, my former UN colleagues that are here, I want to salute you, and also our partners, including the one who is really an African for Africa and fighting all the time for us, you know, the Susan Buffer Foundation. So, you know, I would like to recognize you, Professor Sanait. Distinguished leaders, ladies and gentlemen, thank you for the opportunity to address health equity and the social determinants of health. That is the topic I was given. An agenda which is central to Africa's inclusive transformation and to the African Union Development Agency's mandate to turn continental commitments into practical delivery. Health equity is not achieved by the health sector alone. It is achieved by the conditions in which people are born, in which people grow, learn, work, live, and age, and by the public choices that determine whether those conditions protect life or reproduce vulnerability. The data are unequivocal. Global evidence shows that social determinants can shorten healthy life expectancy by decades. The difference in life expectancy between countries is as wide as 33 years. Children born in poorer countries are 13 times more likely to die before the age of 5 than children in wealthier countries. And eliminating wealth-related inequality within low and middle-income countries could save an estimated 1.8 million children every year. These figures tell us that health inequity is not accidental. It is produced where access to quality education is limited, literacy is low, nutrition is inadequate, housing is unsafe, water and sanitation are unreliable, livelihood are insecure, transport is unavailable, and essential services are too distant or too costly. In short, Your Excellencies, health challenges cannot be dealt by ministries of health alone. We need multi-sectoral coordinated approaches at the national, regional, and continental levels. A mother, ladies and gentlemen, may arrive at a facility with complications, but the chain of risk often began much earlier, with poor nutrition, interrupted schooling, insecure income, inadequate transport, weak primary health care, and delayed access to quality-assured medicines. The strategic implications, ladies and gentlemen, is clear. Disease-specific progress cannot be sustained on systems that continue to reproduce vulnerability. Social determinants must therefore move from the margins of health policy to the center of how we plan, how we finance, and how we deliver development. For Africa, health equity must become a disciplined model of government. It must guide how we allocate budgets, design infrastructure, strengthen primary health care, expand social protection, build resilient supply chains, and use data to identify who is being left behind. This is, ladies and gentlemen, precisely where the African Union Development Agency's work is relevant. We operate at the intersection of health, financing, infrastructure, industrialization, agriculture, education, digital transformation, and regional integration. Our task is to help member states translate equity from a principle into implementation. First, we are advancing sustainable and equitable health financing through the Africa Leadership Meeting on Investing in Health, which is led by President Kagame, and the Program for Investment and Financing in Africa's Health Sector. The Africa Union Development Agency supports member states to strengthen health financing governance, mobilize domestic resources, unlock blended capital, and develop investment-ready health programs that respond to national priorities. The focus is not only to raise more resources, but to ensure that resources are allocated to the people, to places and services where exclusion is greatest. Primary health care, community systems, women and children, underserved districts, and the medicines and technologies that save lives. Second, we are strengthening primary health care as the front line of equity. Strong primary health care identifies risk earlier, prevents diseases, links households to nutrition and social protection, and brings quality services closer to communities before illness becomes catastrophic. Before we get all these pandemic things that my dear brother was talking about, the Ebola and the HIV/AIDS and all the pandemics and epidemics. Third, equity depends on access to essential medicines and health technologies. For too many Africans, the distance between a diagnosis and treatment is measured not only in kilometers, but in price, in availability, in regulation, in procurement, and supply chain delivery. African Union Development Agency's 24 priority medicines and the securing access to life-saving medical products, which we call SCALE, initiatives, addresses this full value chain by aligning regulatory strengthening, local production, pool demand, financing, and last-mile delivery around the products with the greatest potential to close access gaps. Through the Africa Forum for the Federations of Medical Products Manufacturers, we are coordinating private sector efforts towards local production and access and preparing the African manufacturers for competitiveness. Fourth, through the African Demographic Dividend and Sexual and Reproductive Health Program, we are addressing inequity where it is mostly deeply reproduced in the lives of women, adolescents, and young people, courtesy of my dear sister, Professor Sanait. The ADRI is out on a past 5-year program supporting member states and regional economic communities to strengthen sexual and reproductive health, primary health care, and universal health coverage, while investing in young people as the foundation of Africa's demographic dividend. It moves SRH beyond a narrow service agenda by connecting it to education, youth employment, social protection, gender equality, financing, and accountable institutions so that girls stay in school, young people access quality care, and national commitments translate into financed implementation. Finally, equity requires better data. We must measure who is served, who pays, who is protected from hardship, where medicines are available, which districts are falling behind, and where investments are reducing gaps by income, gender, geography, age, and disability. Excellencies, in addition to these health initiatives, our Skills Initiative for Africa and Education Program are helping member states bridge the gaps in education skills development and youth employability, key social determinants of health and well-being. Furthermore, through our agriculture, food systems, and nutrition programs, we are supporting efforts to improve food availability, strengthen access to nutritious diets, and enhance the nutritional status of families with particular emphasis on women and children. Excellencies, addressing Africa's health challenges requires a comprehensive, multi-sectoral approach. Health outcomes are shaped not only by health, just a minute, by healthcare systems, but also by education, employment, food security, and all the other broader socioeconomic development. Real change in health inequity will require us, finally, to govern differently. It will require health finance, education, agriculture, infrastructure, trade, and social protection to organize around the same people and places using shared data, shared accountability, and shared investment plans. Health equity must be visible in the way we allocate budgets, build infrastructure, procure medicine, design digital systems, protect households from financial hardship, and deliver services to the last mile. Because the Africa we want will only be realized when the circumstances into which an Africa is born no longer determine the quality, dignity, and full potential of their life. I thank you and sorry for taking that.
Merci. Merci, Excellences, Mesdames, Messieurs. Nous allons finir cette série de présentations avec celle de la directrice générale de l'Agence africaine des médicaments, AMA, Dr. Delès